Welcome to the University of Michigan Hospital. We are glad you have chosen us for your care. This video will provide patients who are having head and neck surgery with important information they will need when they get home, as well as several other procedures that you will need to perform prior to being discharged from the hospital. Since individual circumstances may vary, it is important that you discuss the specifics about your surgery with your surgical team and nursing staff before heading home. There are 4 modules contained in this video. Each covers a specific procedure, including suctioning your stoma, stoma care and cleaning, as well as tube feeding and tube medication. There are additional topics covered in the head and neck reference guide that you have been provided with. Please review this prior to discharge. Module 1. Suctioning your stoma. If you have a stoma, there is no connection between your nose, mouth, and lungs. Your stoma is now your airway. There are 11 steps to follow when properly suctioning your stoma. Even if you do not feel congested, you should clear your stoma several times a day by following these steps in order. Before doing anything where you will be dealing with your stoma, always wash your hands thoroughly with soap and water.
Fred, you need some suction? Okay.
Prepare your supplies in a clean area of your home. These will include clean gauze, your suction machine, a cup of fresh tap water, a clean catheter, a mirror to help you see what you are doing, and some saline. Please note that the saline may come in a different container than what we use at the hospital. It may come in a syringe or a small bottle or even a spray. Your home care nurse can assist you. It is important that you use the saline to stimulate a cough and loosen the secretions. There are a variety of suction machines available, but they all work the same way. Turn yours on and set the amount of negative pressure to medium suction. Breathe deeply a few times. Taking a few breaths beforehand may make suctioning more comfortable. Squirt a small amount of saline into your stoma. 3 to 5 cc's, which is not more than a teaspoon, is all that is needed. The purpose of the saline is to promote coughing. You will feel the urge to cough at this point, which is good. By coughing, you are bringing unwanted secretions out of your lungs. Now you are ready to insert the catheter into your airway. Ensure that the vent hole is not covered and gently run the catheter down about 4 inches. Caution: be careful not to suction too deeply. It can cause irritation, which may cause bleeding or blood-tinged mucus. When you insert the catheter, if it feels as if the tip is hitting something, then you are too deep. If this happens, pull the catheter back slightly. Before removing the catheter, remember to close the vent hole with your thumb, which will now cause the tip to draw up secretions. With the hand that is not occluding the vent hole, twist the line between your fingers as you pull it out of your airway. The act of removing the catheter should take you no longer than 10 seconds to complete. Repeat the suctioning process if necessary until you feel that your airway is clear. If your airway has been cleared, dispose of the used catheter and clear your suction line with tap water until it is free of any secretions and residue. If you are unable to clear your airway, look inside the stoma. Try to remove any visible crusted mucus. If this doesn't help, you should call 911 immediately. Review these 11 steps that are needed to properly suction your stoma. You may repeat this module now or at any time, and please feel free to ask your nurse or healthcare provider if you have any other questions. Module 2. Stoma care and cleaning. Learning to properly care for your stoma is a very important part of your recovery. There are 5 steps that you need to follow when cleaning your stoma. You may need to repeat this process at least 3 times per day. Before beginning this or any other procedure involving your stoma, wash your hands thoroughly with soap and water. Please note that in this demonstration, the nurse is wearing gloves because of the hospital setting, but in your own home, gloves are not required. Prepare your supplies. These will include saline, gauze, your suction machine, a clean catheter, clean swabs, a pen light, a pair of hemostats or tweezers, and a mirror to assist you in seeing your stoma. You will also need a cup of tap water and some hydrogen peroxide. In order to clear any secretions, you should attempt to cough or suction your airway. This process is covered in Module 1. Clean around the stoma with half hydrogen peroxide and half water.
First, we're going to clean the outside. Then the inside.
Use hemostats or tweezers to remove any crusts. To avoid bleeding, do not remove any crusts until loosened or softened with normal saline. Using your pen light that will be provided for you at discharge, look inside.
Let's take a look. Make sure there isn't anything else in there.
Does it appear pink and moist? Your stoma should look like the inside of your mouth. If it does not,
in there.
you should repeat steps 1 through 5 of this module.
Looks good. All done.
There are 2 very important points to remember when cleaning around your stoma. First, make sure whatever skin you make wet, you should make dry. In other words, dry your skin completely after cleaning. The second very important point, you should always make sure to never double dip back into the hydrogen peroxide water cleaning solution once your swab has touched any part of your stoma. These are the 5 steps to remember when cleaning your stoma. This process should be repeated at least 3 times a day. Module 3, Tube Feeding. Depending on the type of surgery that you have, you will be fed through a tube in one of these 3 methods. A Dopov tube is placed through your nose. The gastrostomy or jejunostomy tubes are surgically inserted through the abdomen wall and empty directly into your digestive system. Regardless of what type of feeding tube you have placed, the basics are the same, and there are 10 steps to follow. First, wash your hands thoroughly with soap and water. Second, start with a clean work surface and assemble your supplies. These will include formula, feeding bag and tubing, tap water in a measuring cup or graduated cylinder, and a 30 to 60 cc syringe. Start your tube feeding in a seated and upright position. Sit in a comfortable chair, and always be sure that your head is above your stomach. Check for tube placement. Each tube is marked with ink or a stitch at the point where it is inserted into the body. Make sure your tube is in the right place. If it does not seem to be correctly positioned, call your doctor or visiting nurse.
Yep, tube's where it should be, right at the line.
Fill a syringe with 30 cc's of room temperature tap water. Clamp your tube before removing the cap at the end. Then firmly insert the syringe into the port. Now unclamp the tube and send the water into the line. This will flush the line and assure that it is ready to deliver the formula. Make sure the tubing is clamped in the off position. Check to make sure you are using the recommended formula. Then shake the can well before filling the bag and closing it. Hang the bag on a convenient and elevated hook. Be sure the feeding bag is above the level of your stomach. Before connecting the line to your feeding port, remember to prime the tubing with formula. This will ensure that no air will be introduced into your stomach. Close off the roller clamp when the formula has filled the entire length of the tube. With the clamp on the extension tubing and the roller clamp both closed, you can now attach your primed feeding tube to your feeding port. Open both clamps and adjust the rate of flow as tolerated. After the formula has all been delivered, there are a few final steps to remember. To prevent nausea, vomiting, and aspiration, you'll need to keep your head and chest above your stomach both during and for at least 30 to 60 minutes after each feeding. Flush the feeding tube just as you did in step 5. This is a very important step to take. This prevents the feeding tube from clogging. You should also rinse the feeding system with tap water and store in a clean place until next use. Please review these 10 steps that are needed to properly deliver formula via your feeding tube. Proper nutrition is a very important part of your recovery, so if you have any questions, please feel free to ask your physician or nurse. Module 4, Tube Medication. Just as you will need to get your nutrients through a feeding tube, your medications will also be delivered in a similar manner. Try to get all of your medications in a liquid form. If they do not come as a liquid, you should ask your pharmacist if it is okay to crush a medication or open a capsule to dilute it in a specimen cup. These are the 8 steps that you should follow to properly administer your medications. Before beginning, wash hands thoroughly with soap and water. Be sure to have some water, a 30 to 60 cc syringe, all of your medications, a pill crusher if needed, and a specimen cup with a lid. Prepare medications by mixing with at least 30 cc's or 1 ounce of water. If it is in pill form, crush it into a fine powder and mix it with water. If you have a drop-off tube, be sure any crushed medication is reduced to a fine powder before adding water. Drop-offs are narrow tubes and can be clogged if particles of medication become lodged in the tube. If it comes in a capsule form, open the capsule and empty it into 30 cc's of water. Replace the cap and gently mix until dissolved. Always check to ensure that the feeding tube is properly placed. Each tube is marked with ink or a stitch at the point where it is inserted into the body. Make sure your tube is in the right place. If it does not seem to be correctly positioned, call your doctor or visiting nurse before taking the medications. Before taking medications, flush the tube with 30 cc's of tap water to make sure that it is not clogged. Next, carefully draw up the medication into your syringe. Make sure that you are sitting upright. Now clamp the feeding tube, open the cap, and put the syringe tip into the port. Unclamp the line and slowly deliver the medications into the tube. When finished giving the medication, flush the tube again with 30 cc's of tap water. This will make sure that all the medication is out of the tubing. Clamp off the feeding tube, rinse out the syringe and the medication cup, and place in a clean area until next use. These are the 8 steps you must follow when administering any medications through your feeding tube. Make sure you are familiar with each and comfortable with using the syringe. We hope this video has helped to clarify some of the most important procedures that you will have to perform on a regular basis. Please feel free to review any of these modules, and if you have any questions, please refer to your Head and Neck Reference Guide booklet, or ask your physician or nurse. We would like to thank you again for choosing the University of Michigan for your care.